Hi, everyone. Welcome back to another Facebook Live interview with the National Spine Health Foundation. I'm your host, Erica, and I'm excited to be joined today by Yonni Wattenmaker. She is the Executive Director of the Breast Cancer Alliance. Thank you so much for joining us today.
Oh, it's my pleasure.
Yes, absolutely. Well, you're not in the wrong place, spine health friends. We are bringing on someone from the Breast Cancer Alliance because this week we have a webinar, a joint webinar with them on Thursday, the 22nd at noon, which you can sign up for at. Give us that address again, Yonni.
breastcanceralliance.org/events.
Yes. So breastcanceralliance.org/events. We're going to put that link up in the text when we close out. But it is a pain management webinar. We're going to be joined by all kinds of doctors and experts who deal with both back pain and breast cancer, how the two integrate or intertwine or cross over. There's a lot more than you may think, and we're excited to bring this presentation to you. But we wanted to talk to Yonni a bit about her organization today, since we are partnering up. So I guess let's kick it off by tell us a little bit about yourself and the Breast Cancer Alliance and what you guys are all about.
Happy to. So Breast Cancer Alliance, we're celebrating our 25th anniversary this year since our founding. When we were founded by 6 women living in Greenwich, Connecticut. They were all friends, and one of them was dying of metastatic breast cancer. And they knew that they had the ability to do something meaningful to impact the landscape of breast cancer, rallied some friends, put together a fashion show with Neiman Marcus and raised some money, and they were off to the races. And for a long time, it was really a Greenwich-centric organization. But over the years, as we grew and developed what turned out to be a really niche market within the breast cancer space, we felt like what we had to offer was something that would resonate nationally. And so for the past about 5 years now, we have been funding research in various parts of the country. And we also do some other things too that have a national presence. So to give you a sense of who we are, the mission of Breast Cancer Alliance is really to change the landscape of breast cancer, improving outcomes, improving quality of life for those impacted, and supporting the underserved. And so our mission has a 3-pronged approach, whereas many organizations focus either on research or on support for underserved patients and other things. And so the first area of funding, which is still very regional, we feel like it's our way to give back to our home base community, is that we support breast health needs for underserved patients. So whether it's paying for mammograms, biopsies, co-pays, patient navigation, mobile mammography vans, it's very important to us that financial burden need not be a barrier of care to quality treatment. And so we fund up to 25% of our capacity each year for our grants toward that specific area. The second thing we do, which is totally unique to Breast Cancer Alliance, is that we fund the training of future breast surgeons. We pay for breast surgery fellowships in New York and New Jersey and Connecticut at institutions that have been accredited for a minimum of 2 years by the Society of Surgical Oncology. So it's like funding the Ivy League. It's the best place for these doctors to get trained. We are the only foundation in the United States that we know of, other than private family foundations, who funds these surgical programs. And these doctors go on to open breast centers in parts of the United States where there never before was a designated breast center, perhaps never before was a breast surgeon. And others go to communities where there just wasn't enough for the number of breast cancer patients they've seen. One, in fact, is in Ireland and opened a center there.
Oh, wow.
We're very proud of it. We're very proud of it. And it's got this beautiful multiplier effect because in 1 year they are on the front lines changing lives. And lastly, which I know was a question you had and I think ties nicely to the seminar, is we fund research. And different than other breast cancer foundations, we come in at the very early stage. And by early, I mean nascent, not early stage breast cancer. And we fund things looking at triple negative breast cancer, which is a very elusive type of breast cancer. We look at metastasis. We look at whether that's in the bones or in the brain. We look at new types of detection, and we fund projects that try to figure out whether or not breast cancer is going to progress. And therefore, if it's not going to progress, what kind of treatment you might be able to save a patient from enduring. So we're incredibly proud of the work we do. It got a little more complicated last year, like so many did during COVID. But, we've known about the National Spine Health Foundation for a couple of years now. And so, we're so happy to be bringing important messages forward that affect, all of our communities.
So how did you personally get involved with the organization, and what gives you a passion for the cause?
So this is going to sound different to many of you, but I am the granddaughter of a breast cancer survivor, but it was my grandfather. And he was diagnosed before I was born at 40. They told my grandmother, thankfully they didn't tell him, he had 4 to 6 months to live. He died at 97.
Wow.
He had a mastectomy and 1 lymph node removed. And it's hard not to notice when you spend a lot of time with your grandfather when you're growing up that his chest looked different from other men. And I'm not sure at what age we first started talking about it, but I also happen to be Jewish of Ashkenazi descent, which is a community in which breast cancer can run rampant. And so the older I got, the more people I knew who were being diagnosed with breast cancer. And I always was in and wanted to remain in the nonprofit space. It was important to me that if I was going to be working full time and not home full time raising my child, that I was doing something that would make him proud when I wasn't home. And about 10 and a half years ago now, I had a friend who had just turned 40 and was diagnosed with metastatic breast cancer. And at the same time, this job fell in my lap. And I said, I'm taking this job and I want you to have my grandfather's outcome. And, I knew a lot less about breast cancer at the time. She lived about another 5.5 years and unfortunately lost her battle. But it's just been such an incredibly impactful and humbling experience to spend this last decade really helping people find access to doctors in all parts of the country because of the network that we've established, seeing this research come to fruition and go on to get funding from the Department of Defense or National Institutes of Health or from other organizations who pick up the funding and just have more capacity to take it down the line and carry that ball. And to hear from the fellows who we've funded about the communities they're now serving. I mean, every day is a new story. And it's just incredibly gratifying to know that the hours I'm spending working are really helping to transform people's lives. And education is key to that. I was in education before this, and I have a very strong commitment to bringing education to people because I don't know about spine health, but I know for breast cancer, even the most educated among us either know very little about certain health areas or don't want to know because they feel like not knowing makes it less. And so events like this are very important to me.
Yeah, I bet you get that a lot with breast cancer because people are so scared of it and they kind of want to maybe run away from the knowledge or understanding of that. I know in my family, we have breast cancer in my family and we were all tested for the BRCA gene, and my sister had it and I didn't have it. And a lot of women in my family ended up undergoing double mastectomies, preventative double mastectomies. And we were just so thankful that research had led to the knowledge that we could have that test and be able to know, and then be proactive about what we were doing. So I think that research and education piece is so very important. Can you tell us a little bit about maybe some of the kinds of pain that breast cancer patients face and what, maybe people don't know about?
Well, it's an interesting question because unlike a lot of diseases, pain is generally not a symptom for breast cancer. So very often women will feel pain or tenderness in their breasts and assume that it means they have cancer. And very often it's related to hormonal changes or they could be ovulating or they had an injury or they pulled a muscle, and there's just so much fear around it that is a natural inclination. But most of the pain associated with breast cancer comes from the treatments themselves. So whether it's recovering from surgery, or sometimes there are challenging reactions to medication. There are some medications which, I don't know if your family had this experience where people can take medications as a prevention, like a tamoxifen. And some people tolerate those drugs very well, and other people don't. And they get neuropathy where they, have pain or tingling or numbness in their fingers and their toes. And again, depending on the surgery and the kind of treatment, you can have bone aches, you can have fatigue, which, isn't pain, but of course it magnifies the pain that you're feeling when you're tired and then you're cranky and your hormones are out of whack. So it's those kinds of things. I should say, for people listening at home, I'm not a physician. So it's important for you to come to this event because physicians will be the ones answering these questions. But as I mentioned earlier, breast cancer can metastasize to the bone, can metastasize to the brain or to the lungs, to the liver. So there are different symptoms associated when things like that happen.
Yeah, we're going to have a fantastic panel of doctors to speak about these things on Thursday. We really hope that people can make it. And I don't know if we'll be taking questions live, but we will be taking questions. So we'll find a way to get those answered for you. We actually have a Facebook event up on our page right now. If you go to the events section, you can RSVP and get the link. So just putting that out there. Just a couple more questions, Yonni. I was going to ask.
I just want to mention that the event is being generously underwritten by Daiichi Sankyo, a wonderful pharmaceutical company making strides in breast cancer. And so this event is free to anybody who wants to participate, which is important to note. And so,
yes, 100%. Yes, thank you so much. When it comes to research, is there anything you can share with us about things that you guys have discovered lately, or just progress that we can maybe be thankful for and be hopeful for?
Sure. There are two that come to mind immediately. One is we had the pleasure of funding a researcher up at MIT. Her name is Regina Barzilai. She was a computer science artificial engineering researcher who was diagnosed with breast cancer. And when she was diagnosed, she was curious about whether or not it could have been caught before it was caught. And so she went back and looked at years of imaging from her mammograms to see if there was anything she could detect. And she found the tiniest little spot that grew over time. And what she decided to do is to start to use artificial intelligence to gather imaging from mammograms to try to determine if they could tell if something was going to progress to cancer. She has had remarkable success. She is very easily Googleable because of the strides that she's made. And she's been, it was a real feather in our cap to have been able to grant her research because she's, continued to go on from there and make some really great strides there. And so it's very exciting. It was in partnership with, I think they were working very closely with Massachusetts General Hospital, working on some of their patients using their, radiology files. So that's one in recent memory that comes to mind. And one that just happened this last year, we just had at our annual dinner, we had a presentation about it to our board of directors and our advisory council and medical advisors. We funded some research with Nora Desis at University of Washington in Seattle. She is working on breast cancer vaccines.
Wow.
And she is finding success, and our funding led her, she hasn't been able to give us the details yet, it's not public, but has led to a wonderful grant that will allow her work to continue. And it's vaccines are different. We're all talking about COVID vaccines. It's very different. Unlike COVID, which you hope not to get, and that's why you take the vaccine. With her vaccines, the trials have been done on patients who have already had breast cancer, but it's using your tumor cells to develop antibodies to fight your own system. Yes.
Wow, so, that is really cool.
Those are two examples of which we are incredibly proud. But we have a lot of our research is looking at challenges either in the development of metastasis or how to treat breast cancer once it has metastasized. Because if it's caught early, 90% of breast cancer is survivable.
Wow, that's really something I think people need to know
Yes.
about and get them, get their regular checks and get to the doctor and all of those things and be proactive. That's so important. Well, thank you so much for sharing a little bit about the Alliance and your work with them. I mean, I can't wait to hear more on Thursday about, what all of our experts have to say about these things. Thank you so much. What's the best way for people to collaborate with you guys or to reach you for any of the things you're working on?
Sure. So all of the information is on our website, breastcanceralliance.org. I'm very easy to find. We only have 2 full-time staff. So, email us and I will get your email. And I just want to say we are having one other free event. And I would like to mention it only because, again, it ties in with what we said. On May 13th at noon, we're doing a free program on genetic screening and the importance of genetic screening and who should be tested and what do you do with the information once you have it. And so, again, it's at no cost to anybody. It's just to provide information. And so anyone who'd like to come, that's also on our webpage at breastcanceralliance.org on the events page.
Right. And that's exactly what I was talking about earlier that we did in my family. That was so helpful to us. So thank you so much. And thanks everyone for watching, and we'll see you next time.